COVID hit a little bit later here, mid-March. I got a call from our elder life specialist who had just heard from the head of hospital volunteer services that the hospital was no longer allowing volunteers to have any presence in the hospital. And literally our program ground to a halt. To further compound the situation, and what really troubled me dramatically is that shortly thereafter, the hospital said that in addition to this, we are no longer allowing any visitors with patients in the hospital. So now I knew that we had older people being admitted to the hospital who, even before COVID, were at very high risk for delirium. We could not deliver our program to help prevent it. And to further compound the isolation that these people would be experiencing, they no longer have any exposure to the outside world through their family, friends, or caregivers. So fortunately, I guess, as you've heard, on my ambulatory care side, I had just come from a meeting with our clinic group, and we were trying to get up to speed and ramping virtual visits to deal with the need to deliver care to our outpatient clinic patient population in the setting of not having the ability to bring them into clinic. And it occurred to me, well, if we can do virtual visits in the clinic, why can't we do virtual volunteer visits with patients in our hospital? So that was the light bulb that went on. The action steps is to bring iPads into patient rooms through which they can connect with our elder life trained volunteers and deliver virtual help interventions to at-risk older people in our hospital. I first made a call to our advancement team, and we were able to identify a donor who supported ultimately the purchase of 60 iPads and the floor stands that we needed to get this delivered. We had to find a space for the volunteers. We had to adapt the elder life interventions to be delivered virtually.